Okay, so I'm going to try to show you how the inserts work on the pump flange and try to demonstrate why that might help to downsize most people. So our pumps come standard with a 25 millimeter flange. You can see the numbers on the side. They do come with a 28.5. Very, very, very few people need that. So we're always going to start with a 25, but typically we need to downsize. So again, especially if they are exclusively pumping, mom's pumping for NICU babies, or it's causing them pain, or you can tell that the nipple is much smaller than what this shows. So I'm going to use this breast model. This is a very small nipple, so this is not going to be the best example, but I want to show you what it might look like. If I can, it's kind of hard with the glare. Trying to do the best you can here. So you're going to have mom center her nipple the best she can. You can kind of see the top and the bottom and how much room is around that nipple. That's just way too much room. So we're going to start our pump on stimulation phase where it's going nice and quickly. And you can see it's pulling in and there's gapping here on the side pretty severely, like up to here or so. And there's lots of room around that nipple. Now it is moving the nipple, and because this is not actual tissue, it's not sucking the tissue in, but likely you would start to see the tissue creeping into this chamber. The longer mom's pumping, she might express some pain around the edges or just sore nipples in general, or soreness at the tip. So you don't want to see all this gapping around the side. So if we pause that for a second, and the smallest size I have here is a 15 millimeter, which is still going to be way too big for mom. She's probably like an 11 in this case. You can kind of see here, if I can sort of center it, that there's still lots of room around there, but much, much less than the 25. So the inserts just sit in. You want them nice and snug, so they're flush around the side, so there's no air gapping in. And then again, we want to try to center everything so that there's no rubbing on the sides. So again, we're going to turn our pump on, and let's see if you can see. It's a little bit harder to see with the inserts because now it's double plastic. But you can see there's still some gapping because this is still big, but it's a little bit less. It's more just towards the end of the areola and the nipple. And then you see that nipple moving in and out still. And there, you can still see that there's a gap here because of the way that the plastic is. But the inside is much smaller. You can't quite see it with the way the reflection is. But you want to isolate that nipple, and even if this is too big still for mom, it's going to be a lot better than the 25 that's way too big. So she may still have some tissue coming in to the chamber, she may still have some discomfort, and it may still not be the most optimal for what she needs for pumping, but it'll be much better than going with the 25s. So I'm not sure, again, if you can see that. Let's see if there's another angle that would be... So you can see a little bit, it's not really pulling in as much there. But anyhow, that's the idea with downsizing and why it's important, not only for comfort, but for functionality and efficiency with milk removal, especially in the early days with colostrum. But again, sometimes they won't see anything for a couple days, so it's not always they won't always see something coming out, but it will help with the stimulation to help the milk come in a few days. All right, let us know if you have questions.